So the management, like I say, another pathway: control the bleeding point if any, cleanse the wound, remove any dead and devitalised tissue if appropriate, and any foreign bodies that may have crept in there. And when we say cleanse and debride, that's a slight crossover word, isn't it? Because if I asked you in this room, how many people in this room do a debridement, you will put your hands up and say, who does a debridement in this room? 2, 3, 4, 5. 5 out of 100 people, so 5% do debridement. I would challenge you all, if you're all looking after wounds, and say that you're probably all debriding, because you are creating a warm environment that allows for autolytic debridement. So you're all promoting debridement. Or you could be cleansing stroke debriding. It's a dodgy one like that. So reapproximate the wound edges if you possibly can. Do not steri-strip. Dress the wound appropriately using a silicone-based contact layer, something that you don't have to keep removing. It is not appropriate to keep removing it to have a nosy, because we are nosy nurses, aren't we? I'm a little bit like that. I have to have a look, but no, I won't do it. So please put a dressing on, a primary dressing that you don't need to keep taking off. Now Richardson have got their dressing that they've put round and you've got in your hands. I can see it in your hands now. If you haven't already, when you leave the room, you might want to have a little fiddle with it and just see how comfortable it is to put on and take off. If you want more information on this product and how comfortable it is, how cost effective it is, and also their skin tear emergency kit boxes, then please go to their stand. What I would also say to you is this: when you go to Richardson's stand, you've got breaks that allow you sufficient time to get to all the stands. You've come on your time today, make the most of it, get around all the stands, make sure you get as much information from those company representatives, and make sure you take away as much learning as you possibly can. So monitor. Don't take a skin tear primary dressing down. How often should I look at it really? I would say 5 to 7 days is the guidance. 5 to 7 days is your primary contact layer. Don't take it off. That's not to say if you've got leakage through onto your secondary, you change your secondary dressing. And please remember, document, document, document. If it's not documented, it's not done.